Hi everybody, my name's Sean, and today I want to talk to you about the laws and benefits of medicinal marijuana. My wife Keisha has recently come across a rather painful injury to her shoulder and neck, and it is the doctors refer to it as an impingement of her rotator cuff. She does not want to be treated with narcotics, so after the advice from her doctor, she has been prescribed medicinal marijuana, which is legal here in the state of Michigan. Today I have with me my wife's medicinal marijuana prescription card from the state of Michigan. I also have what they refer to as a medible, which is an edible marijuana baked item, and this is actually banana bread, and the medicinal marijuana is baked right into it. I also have about a gram of the actual medicinal marijuana that my wife is prescribed. She prefers to cook with it, but occasionally will smoke, and it really has worked wonders for her. She's not nearly in as much pain as she used to be, and it's done a lot of good for her. And so, after seeing what it's done for my wife, I've become a staunch supporter of it. For years and years, the debate over the issue of medicinal marijuana and its proposed benefits for the patients who use it legally and in a responsible and secure environment has been on the front lines of the national media. According to Vikovich, it has become one of the most passionately debated policy issues of the early 21st century, and marijuana has been referred to as both the devil drug and a miracle drug. Medicinal marijuana has certainly become an issue where the proponents and opponents of the drug have unforgivingly held steadfast in their opinions, and neither room appears to be showing any room for leeway. Critics of medical marijuana have made claims that the regulated and state-licensed dispensaries in which the drug is sold and dispensed will also attract the promotion and legalization for other illegal narcotics as well. However, medical marijuana is a legitimate and very appropriate drug that should be legalized for patients that are suffering from debilitating illnesses and/or injuries. In 2008, Hall reported that since 1996, 14 states have passed medicinal marijuana laws, and several more states are considering that possibility. So finally, the days of the past when marijuana was considered illegal for persons that used it for medicinal reasons are just that, they're the past. So, and also in modern day time, patients will now line up at dispensaries throughout cities and states where the plant is medically legalized, and there continues to be a plethora of ailments and injuries that justify the reasons why a patient can be prescribed medicinal marijuana. They can range from cancer, hepatitis C, and AIDS. And according to a recent report from the International Business Trade, medicinal marijuana is most commonly prescribed for cancer of the lung, breast, and pancreas. Patients that suffer from ailments which are not as nearly as severe as the aforementioned diseases continue to find exceptional relief from the use of medicinal marijuana as well. These ailments also include anxiety, glaucoma, and chronic pain. Vikovich also reported that the use of medicinal marijuana has resulted in very therapeutic findings that are consistently noted in the body of this literature, including treatment for pain, nausea, and vomiting, wasting syndrome, and appetite stimulation. However, through all of the benefits that medical marijuana provides its patients, there has been a common misconception that the drug has very adverse effects, one of which includes addiction. However, this is not true, and according to Gutwillig, since the approval of medicinal marijuana in the state of California in 1996, there has not been an noted production of marijuana consumption and addiction within its patients. So it's contrary to prior popular belief, it's not an addictive drug. Legislators and politicians that oppose medicinal marijuana, they must realize that it is indeed a very beneficial drug, and they must also ask themselves, what would they do if they were put into a position where if they obtained a painful or life-threatening disease, could medicinal marijuana benefit them, or a family member even? Or does the continued prescribing of extremely addictive opioids such as hydrocodone or OxyContin safely pave the road to the freedom from severe pain? It is irrefutably a proven fact that opioid addiction is one of the most severe forms of addiction in the world. And according to Ling, Mooney, and Milhouse, the use of opioids other than as prescribed can take several forms: misuse, abuse, and dependence. Physiological dependence, which involves the presence of tolerance and withdrawal symptoms, may occur even at prescribed doses in non-addicted individuals. So this presents the question once again that we must ask ourselves, and the answer is clear and concise. Is the constant prescribing of these severely addictive narcotics the answer? And in my personal belief that we need to continue to present legislation in other states towards the legalization of non-addicting medical marijuana for prescription relief from the pain and suffering of multiple diseases and ailments. The legislatures whom are opposing medicinal marijuana are not only the only hills that patients will have to climb. In many states, it is illegal for a patient to be under the influence of their medicine while at work. According to Rubin, the Oregon Supreme Court has ruled that workers who are under the influence of their medicinal marijuana to relieve pain or nausea may be fired for drug use even if they hold a valid state-issued medicinal marijuana card. This to me is discrimination in its finest form. To prevent these patients who are suffering to be able to properly medicate themselves while they're at work is wrong, and it should be illegal. Would we not allow an individual who suffers from any other form of medical ailment to medicate themselves with their prescription medicine while they're at work? The answer is no. However, states such as Oregon continue to prevent their employees from properly allowing themselves to use their prescription marijuana, simply because of the fact that there's a fear of them being terminated from their place of employment. So I'm not saying that these employees should sit around and smoke their medicinal marijuana all day while they're at work. I just think they should be able to properly medicate themselves before they go into their work site. Many medical marijuana patients prefer to use the drug as the main ingredient in a buttery substance, which is then placed into foods. And as I talked about earlier, these foods are known as medibles. The result is a much less intense mental effect and more of a full body effect, which therefore treats their ongoing pain. Throughout the years, Americans have continually frowned upon marijuana simply based on the fact that it has been classified as an illegal narcotic. These critics continually fail to see the benefit that the drug provides for patients who use it for pain and for discomfort. Is there an abundance of people that misuse the drug for the sole purpose and reason to get high? Of course there is. The same can also be said for alcohol and many other narcotics. These facts do present themselves, however, in black and white. And the facts continue to be that no one has ever overdosed from marijuana, and no one has ever been addicted to marijuana, and no one has ever killed anybody while fueled from an incoherent marijuana-driven rage. According to Melamed and Way, to maintain that marijuana is a dangerous, addictive drug with no medicinal value is scientifically absurd. Cannabis medicines with no effective lethal dose are safer than aspirin, acetaminophen, and most other over-the-counter drugs that kill thousands of Americans every year. Also, according to the National Eye Institute, marijuana can be used to treat and prevent the eye disease glaucoma, which increases pressure on the eyeball and damages the optic nerve, causing the loss of vision. Marijuana has been shown to greatly decrease the pressure inside the eye, and studies in the 1970s showed that marijuana, when smoked, lowered their intraocular pressure in people with normal pressure and those with glaucoma. So the effects of the drug may slow the progression of the disease, however, they do help in preventing blindness. So ultimately, the time has come for Americans to fully embrace this drug as a miracle worker for individuals with debilitating and life-threatening painful diseases. Marijuana will not cure any of these ailments that I've talked about today, nor will it prevent a relapse of the disease in returning. However, it will produce comfort and relief for patients that suffer from the painful and life-threatening diseases and ailments that they are afflicted with. Thank you so much for watching. Have a good day.